Digital transformation is no longer a buzzword, it's a strategic imperative. Deloitte recently interviewed 150 biopharma leaders to better understand their company's experience with digital technologies and how the industry's approach to digital innovation has evolved in response to the COVID-19 pandemic. I'm Lena Gupta, subject matter specialist at the Deloitte Center for Health Solutions. Today, I'm joined by Aditya Kudmala, principal in our life sciences strategy and analytics practice, and co-author of our recently published report, Biopharma Digital Transformation, Gain an Edge with Leapfrog Digital Innovation, which is based on findings of the survey. Hi, Aditya.
Hi, Lena. Nice to see you again.
Nice to see you too. So let's start out by asking a question about Leapfrog Digital Innovation. What exactly is that?
As you mentioned earlier, right? It's the innovation is a key aspect of any of these organizations, and like you said, it's a strategic imperative. What companies are doing right now is like, how do they capitalize on that? How do they leverage some of the advances that are happening from a technology perspective, leverage that to leapfrog their businesses into the next evolution, whether you call it next gen, whether you call it the evolution of the next business models, whatever the case is, but leveraging these technologies in whichever maturity they are in to stay ahead of their competition and also provide a better experience to their stakeholders.
Got it. And what was the most surprising finding of this report to you?
I think, as you've seen in the survey, there are a number of technologies that are in their various maturity, I would say, in the curve perspective. But it was very consistent in terms of how artificial intelligence, the AI aspect of it, was more and more prioritized from all walks of life or all walks of layers of the organization itself in terms of how they can leverage that to advance their businesses and or the experiences or in terms of how they communicate with their internal and external stakeholders. So it was very not surprising as it, but it was reassuring that the investments that they've made in the last 3 years, they're doubling down to actually capitalize on it and take it to the next level.
And one of the major things we talk about in the report is a digital innovation North Star. Can you share an example of what that means and maybe an example of what a North Star is that a biopharma company might be able to establish?
Definitely. I think, have you seen in the last 3 to 4 years, there's been a lot of experimentation, proof of concepts, incremental, I would say, achievements or successes in their respective areas. What's happened is, that's great, but when you take a step back and look at it, like how is it truly transforming that particular function or a group or an organization, it's been hard to kind of bring all of these together without having a North Star. North Star is nothing but saying, here's what I want to achieve, leveraging these technologies or ways of working or a different op model to go transform this particular function or a group or the company itself. And each of those could be subdivided into their own functional North Stars. Like I want to be a data-driven clinical organization or a analytics-driven commercial organization, or whichever the case is. Those North Stars kind of build up for them to kind of march towards how they invest today, how they align in terms of their people, talent, strategies to go achieve those North Stars in the next, whatever the timeline that they have embarked on. And a classic example would be, as I said, if you want to go deeper into the clinical, like I said, how can I leverage these technologies, digital technologies, whether it's AI, blockchain, whatever the case is, to improve patient experience during the trials or accelerate the trials from the study startup to the conduct and the closeout. Those are the aspects of it that they can put some bold North Stars to go achieve them.
I imagine that's easier said than done in many cases.
Right.
What's been your experience in working with biopharma organizations to this point, and how can they win?
Right. I mean, the biggest challenge, surprisingly, it's not so much about technology, it's the mindset, right? It's change. Like leveraging these technologies to do the old ways of doing things makes no sense, right? So it's a newer way of engaging, ways of working, improvement in terms of what they can do today to the next. So the big aspect is that can everybody align and believe in that North Star, open for change in terms of leveraging this to improve not only the way they do their business, but also with the stakeholders, whether it's internal or external, and then having a game plan in terms of how they align on the strategy, the investments, the talent in terms of supporting this multi-year journey. Sometimes it might be a few months, sometimes it might be multi, depending on how you look at it. and then creating these value streams that are measurable in a way that they can see the growth and or the efficiencies or whichever the metrics that they're measuring against, that they feel a meaningful progress has been made across the board.
I'm just diving into the paper a little bit. We see that close to 40% of the respondents have adopted AI in their day-to-day operations. That's a huge number. Where do you see the most opportunity for AI in the next 3 to 5 years?
Right. I think I'm very encouraged to see that it's been a little bit more pervasive than what it was before. I think we're moving from those, as I said earlier, from a proof of concept, small pilots to like, hey, can I look at the end-to-end value chain within, let's say, clinical trials, and how can I apply AI across the entire value chain within the clinical trials, whether it's study startup to close out or submitting the dossier to the health authorities. How can I leverage AI to really accelerate the trials, improve the patient experience and all? That's one area that I've seen a lot of investments and also interest across the board from our clients and also most of these companies. The other areas are also in the commercial, like given that the COVID has changed the way we engage with our healthcare practitioners and the patients as such. So again, leveraging from a sales and marketing and market access construct perspective, how do we better engage, be data-driven organization, leveraging AI insights to send the right content to the right person, to the right channel, and all those things that have improved leveraging these technologies than what we used to do in the past. Same thing in the manufacturing side too. We're saying, how can we leverage AI within the assembly line or machine line in terms of getting a better yield or deviation management and a bunch of other use cases to really improve the way that we are doing manufacturing as of today. So these are some of the areas, but we're also seeing a lot more on the reg intel. How can I glean from my strategies in the past, successful deployments across the regions, leverage those insights, leverage AI to really get some inform my strategy going forward from a regulatory perspective. We're seeing a lot more on that standpoint too. So here are the examples, but I'm encouraged to see that more and more people are investing, thinking, how do I leverage some of these digital technologies, whether they're AI, other areas of the other technologies, to really leapfrog from what they're doing today.
Well, speaking of other technologies, about half of survey respondents said they use cloud computing to facilitate day-to-day work. How do you see the cloud enabling life sciences organizations today and becoming more agile or improve time to market, or maybe other things as well?
Right. So if you look at it, right, it's a information-rich company. If you look at a life sciences, right, we are accumulating data across the board, all the way from when we're doing drug discovery aspect to doing the clinical trials, and also when we launch products and all. And that requires massive amount of compute depending on what you're doing, right? And cloud has given us the agility to not only do this at scale much faster, but also giving us the flexibility rather than getting the researchers to the data rather than the other way around. So it's given us a lot more opportunities to ramp up and down in terms of the compute that we need or the capabilities that we need, and also the geographic location in terms of all the people working collaboratively. That has really helped us kind of improve the way the folks within the organizations are working, also leveraging some of the insights to really work on the next best action of the outcomes from it.
Do you have any really interesting or neat examples from the recent past where cloud has enabled?
Yeah, I mean, there's tons of examples, right? From how they're like I said, the classic example would be like how companies are actually taking the data from the real world perspective, whether it's claims and other population health, to the data that they have from the clinical trials, to the genomic data sets that they have, omics data sets that they have, and then trying to connect them and see how they can use that data sets for their secondary, tertiary and all, which requires, these are like huge amounts of data that they have acquired and or partnered with, and they're leveraging some of these cloud technologies and tools and techniques, including some of our platforms that we are helping these clients with, to analyze and glean some real good insights, and also not only the insights, but also actions that they can take to really act upon them.
So Aditya, in a recent interview with a global life sciences company executive, they said digital innovation has been accelerated by 10 years by what's happened over the course of the last 18 months. So what do you think the momentum of digital innovation in the industry looks like post-pandemic? What could slow us down? What do you think could keep us going? And what do you think is important for life sciences companies to keep in mind?
Totally, Alina. I totally agree with this life sciences executive. Like, look at that. We've got a drug out, a vaccine out in 11 months. It took a lot of leveraging these digital technologies, people, just collaboration in a different way. All of these factors came together, right? How we parallelize some of these activities and all. And more we ask like, hey, if we could do it for the vaccine, can we do the same for other therapeutic areas, right? And we are looking into that. Not only the life sciences companies are looking at it, but also asking us like, how can we really tap into that success and either make it a systemized across all therapeutic areas or really transform our organization to adopt some of the best things that we did throughout that entire process. So I would say this will continue to accelerate in terms of leveraging. I don't think we're going to go back to the old ways of doing things. It's actually going to go forward. And even further investments that we're making in these digital innovations, new technologies and others will even further accelerate the innovation in the next few years. So I'm very bullish in terms of not only us innovating at the edge in terms of leveraging all these different kinds of technologies, plus also the different ways of doing work or business, but also in a way that we can improve the experiences for all of them, keeping in mind that the patient is still in the center of this and how we can transform their lives across the board. So I'm very bullish about it and very excited on this journey.
That's great. I do have one more question though, which is with so much transformation going on in all aspects of the business, it kind of can be hard to identify or understand the gaps that you have in digital maturity and how your company compares to peers. So how should biopharma companies start to think about measuring their own digital maturity today?
Right. I think they do have some barometer of how they stack up compared to their peers. But in addition, we're super excited that we've launched an online biopharma digital maturity benchmarking tool. It's live. I think it can help these organizations progress their maturity across the board. Look at this from a benchmark perspective, where they stand, whether they're the innovators or fast followers or wait and see in terms of it. But more and more, I think everybody wants to have a competitive advantage leveraging these digital innovations. And this will be a great tool for them to compare contrast.
Sounds great. Well, Aditya, thanks so much for walking us through this report today. Really appreciate it and hope people get a lot out of reading it. So thanks again.
Awesome. Thank you, Lena. It's been a pleasure talking to you.
You too.
Have a wonderful day. Thanks.